Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing bed sores. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So what is a bed sore? So a bed sore, it can also be called a pressure ulcer, okay? So it's when there is injury to the skin resulting from prolonged pressure on the skin, okay? So bed sores often develop over bony areas. So heels, ankles, hips, tailbones. We see this a lot, especially in the elderly who are sitting for long periods of time or who are confined to a bed. Okay. When people have limited ability to change positions, we need to be helping them change positions every 2 hours. Okay. Bed sores can develop with just over hours. Like they can happen very quickly. Sometimes it takes days, but they can happen quite quickly sometimes. Some will heal and some will never heal. It just depends on the state of the patient. So symptoms. So this is actually more of warning symptoms, okay? When we're having skin color change, so we have that reddened area, okay, for when you're sitting too long or laying and there starts to be a reddened area, and you push your thumb into it and it's not turning white. This is the start of a pressure sore, okay? When you start to see that red, we need to get people moved, okay? There could be swelling, there could be pus drainage. The feel of the area, the temperature is cooler or warmer to touch than other areas of the body. They may be tender to touch, okay? Bed sores fall into one of several categories, okay? And their depth depends on severity, okay? If you do want to check out my link, I'm going to have it linked right here, where you can see where they fit. It's called the Braden scale and how at risk someone is to getting a pressure ulcer or a bed sore, okay? So the Braden scale, I'll link that here, and that'll give you a good idea of where somebody's falling in on how at risk they are. So common sites of pressure ulcers, okay? So I did put two different ones here, one for while we're sitting down and one for when they're laying down, okay? So for people who are constantly sitting down or in a wheelchair, their spots that are most common are their tailbones or buttocks, shoulder blades, spine, back of arms, or back of legs that rest against the chair. So you have to think anything that's touching the chair and where we're putting pressure, that is where they're going to get a pressure ulcer. Now, for people who are laying down, a lot of times on the heads, the ears, okay, the shoulders, the lower hips, back, tailbone, the heels, ankles, behind the knees, anywhere that they have a bone that's touching the bed, if they're not moving every 2 hours and they're confined to that bed, they are at high risk of getting a pressure ulcer. So what causes a bed sore or pressure ulcer? So they are caused by pressure against the skin that limits the blood flow to the skin, okay? There's three primary contributing factors, okay? So first one is pressure that we've talked about, when they're just sitting, not moving, and the area is not well padded, okay? So when there's a bone and somebody doesn't have a lot of muscle or fat on them, especially over the spine, tailbone, shoulder blades, hips, heels, elbows, anywhere there's bone that's pressure, that's a high risk area, okay? Then we have friction. So friction occurs when skin rubs against clothes or bedding. It can make fragile skin more vulnerable to injury, okay? Especially if the area is moist, okay? when somebody's confined to a bed, a lot of times they're using briefs. This moisture increases the risk of pressure ulcers. Okay, it starts breaking down the tissue. So we want to make sure if someone is wet or soiled, we want to make sure that they are getting changed out right away, because it is another contributing factor to a bed sore. Next, we have shearing. So this is when two surfaces move in the opposite direction. Okay. So for example, when a bed is elevated at the head and the patient slides down, okay, or the tailbone slides down, this is a shearing force and can cause the skin to break down and easily get a bed sore. So risk factors. So what's going to increase your risk of getting a bed sore? Immobility. If you're not moving, you're at higher risk. Incontinence. Okay, so the skin becomes more vulnerable when it's moist. Okay, so if you're wearing briefs, or have a patient who's wearing briefs, we need to make sure that the stool and urine are being cleaned up immediately to prevent. This is a preventative measure, okay, for bed sores. Lack of sensory perception. If somebody has had a spinal cord injury or just a neurological disease going on, and they can't feel whether they're going to the bathroom, or they don't know if they are wet, they need to be checked very frequently. Okay. They also, so lack of sensory perception, if they're not feeling if they need to switch positions. So sometimes they lose that sensation where they'll lay in one position and it's like, okay, that would hurt us. We move because it's uncomfortable, but they're not feeling that. So really, if you have a patient or someone who you're caring for, you need to be moving them every 2 hours at least. Okay. Poor nutrition or hydration. So if they're not eating and drinking properly, they will have tissue breakdown. And then medical conditions affecting blood flow. So diabetes, vascular disease. If we're having a problem with our blood flow, this is going to increase our risk for tissue damage. Okay. So complications now. So a lot of pressure ulcers we can get healed. But really, so I always like to just talk about this just for a minute, because pressure ulcers, okay, we need to be preventing them, because when we're trying to heal them, we have to do all the preventative measures that we should have been doing. So really, I've had patients, I've ever had patients before, they're like, oh, well, I only like sleeping on my one side. That's the only position I like to sleep in. And they're not comfortable in other positions. But if we don't move you every 2 hours and all of a sudden we need to really be staying off of that side, like it's a catch-22 situation, because you're going to have to stay off that side, right? So we might as well just be moving the positions, going along with it, trying to get as comfortable as we can. So we're staying off of a side for too long, or we're going to have to do it anyways. And then pressure ulcers, they're so hard to heal a lot of the times. So we want to prevent them, okay? And they can become even life-threatening. So complications, one is cellulitis. So infection of the skin and connective soft tissue. Okay, so we can get an infection there. We can get a bone or joint infection. Okay, because there's, say on the elbow here, if we had a pressure ulcer right here, it's so close to the bone. And when we have exposed bone, this is how we get bone infections. Okay, bone infections, super, super hard to heal. Most of the time we're on IV antibiotics for 6+ weeks, something we do not want. Once again, we can prevent this. Cancer. So long-term non-healing wounds can develop into a type of squamous cell carcinoma. Okay, so it can cause cancer being open for a long time. Sepsis. It is rare, but this can turn into sepsis, life-threatening. So prevention. So we can prevent bed sores by frequent repositioning, okay? So repositioning at least every 2 hours. Good skincare, okay? Moisturizing the skin is good. Good nutrition, good fluid intake. If you smoke, quit smoking, manage stress, exercise daily, that gets your blood flowing. Okay, now tips for repositioning. So we want to shift the weight frequently. Okay, so if we're in a chair, you want to just shift your weight frequently. Okay, just make almost up here. make little positions. Don't fall out of your chair like I almost did, but make small frequent position changes. Lift yourself if possible, okay? If you have enough upper strength to be getting yourself up, make sure that you don't fall out of the chair again, but you get yourself up. This is using your muscles. This is helping your blood flow, okay? If you're confined to a wheelchair, you should have a specialty wheelchair, especially when you're confined to a wheelchair, because they tilt back so they can relieve pressure. Okay, so you don't always have to be in one position. So you can go up straight, you can go back, you can go back a little bit further. It does help. They have different types of cushions, even for the chairs. I know the specific type that we use are Roho cushions. And this helps alleviate specific pressure points. Okay, so we don't have those pressure points. It's alleviated throughout the whole thing. So it's like an air mattress when you sit on it. They have those air mattresses for beds too. So if you're confined to a bed, that is something that we would want to look into. We don't want to use donut cushions. So I have this in red here. They can focus pressure on surrounding tissues. Okay, so if there is a pressure sore at the tailbone region, you don't want to use a donut because then it's very concentrated where the pressure is sitting. You would want an air seat where when you move, it's the pressure. There's no pressure in one specific area. Okay, that's what we would want. And then adjusting the level of the head of the bed. Okay, so if they're laying in a bed like a hospital bed, even at home, to elevate it. Okay, you don't want to go more than 30 degrees because this can cause shearing. So the bed's moving in one direction, you're moving down, sliding down in another direction. So we say 30 degrees, then you're not having that shearing force. Okay, so I've also added in here some tips for good skincare because good skincare prevents breakdown. Okay, so keep the skin clean and dry. So you're going to wash and gently cleanse and add a moisturizer to the skin. Okay, if the patient is in contact with moisture, so urine and stool, they need to be cleaned more frequently. Okay, yes, it's great to just use the wipes, but we do need to be washing them more frequently because the wipes don't get everything. Really washing is the best way. Even getting a little basin of water and soap and washing them up. Okay, protect the skin. So use a moisture barrier cream. So if somebody is incontinent, you should be using a moisture barrier cream. You can look on Amazon. You think you can get that worldwide, just a moisture barrier cream. And that'll help prevent if someone goes to the bathroom and they don't know, it'll prevent it until they're changed. Okay, but it should not be used for prolonged periods of time. Like we're not using that to not change someone. You know what I mean? Like we need to be changing them immediately. But if somebody doesn't have that sensation that they're going to the bathroom, and they're being checked once an hour, okay. But we're not using it in place. So the moisture barriers, they can only do so much, right? So we need to be getting that urine or stool off of them immediately. And then we're going to watch the bed. So watch it for buttons. So if they're sitting on a button, their clothing, sometimes they have, I know jeans have those little like hard buttons at the back where the little pocket is. Okay, we got to be careful of those. Wrinkles in bed sheets. Okay, so those can really irritate the skin. And if they're eating in bed, any crumbs can be very irritating. We're going to also inspect the skin daily. Okay, look for the warning signs, look for reddened areas, look for pressure spots. Okay, anything pink, red is no good. We need to get them off of that area, move them more frequently. Okay. So diagnosis, really the doctor just needs to look at it, and normally they can say it's a pressure ulcer. They will also stage the pressure ulcer. Okay. How bad a pressure ulcer is connected to the stage. Okay, so I'll add a link here for how to stage a pressure ulcer. Okay, so I'll add that in here. Okay, so treatment, it involves reducing pressure. So like I said before, really we have to do the same things in prevention as when we're trying to heal a pressure ulcer. Okay, we have to do the preventative measures. That's the only way we're actually going to get rid of the pressure ulcer. If the pressure continues, it'll just keep getting worse. Okay, so we need to care for the wound, control pain, prevent infection, and maintain good nutrition. Okay, we have to do all of those to start healing the wound. Okay, that's why I say prevention over cure. We always want to be doing preventative measures because there's so much added once we have the actual wound, and we still have to do the preventative measures, okay, to get that healed. So what your treatment team may look like. So you'll have your primary care physician, okay? They're overseeing all your treatment, okay? And then you may have a specialized physician or nurse who specializes in wound care, okay? That's a lot of times where I come in. You may have a nurse or medical assistant who provides both care and education. Okay, this may also be the wound care specialist who provides you with this. So it might be the same person for that. You may have a social worker, okay, who helps you and your family access resources. And they also address any emotional concerns that you may have for long-term recovery, because this is a long-term process. Bed sores are not something, especially they can get bad quick. Okay, so sometimes it is a long time to get this to heal. Physical therapy. Okay, this will help improve mobility. Occupational therapy. So they will help set you up with appropriate seating, appropriate equipment that you might need. A dietitian. So they will assess your nutritional needs, make sure that you're getting enough fluids, touch base on all that. And then others your doctor might set up is a neurosurgeon, vascular surgeon, orthopedic surgeon, or plastic surgeon. Just depends on your specific needs, who you actually need in this whole treatment team, okay? But those are the possibilities. Okay, so treatment. Reducing pressure. We need to be removing that pressure. So repositioning and using supportive surfaces. Okay, so this may be the air mattress or specialized sitting cushions. And then for cleaning and dressing the wounds. So when it's a closed pressure ulcer, okay, the skin is not broken, but it could be red or purple. We're just going to wash it with a gentle cleanser and pat it dry. That's all we're doing. If it's open, that's when we're going to be using the saltwater solution, and then it will need a dressing and cover over it. So the bandage that go over it, it should prevent any bacteria from getting in. Okay, so we have to be cautious, especially in the tailbone region, that no fecal matter is getting into this. Okay, so we need something that covers it and it's not going to get dirty and provides a moist wound environment. Okay, we want a wound just as moist as our eyeball. That is the perfect healing. Okay, that's what we need. Okay, we don't want things to dry out. Those any wound that dries out, it does take longer to heal. Okay, that's kind of old method. New method is now we want it just like our eyeball. So bandage choices can include films, gauze, gels, foams. Okay, so really there's a ton of different bandage choices that we can throw on there. They even have ones for specific areas. They have ones that they just fit perfectly for a heel, or they're shaped more in like this kind of dressing for the tailbone area. Okay, so just depends. You can look. Once again, they have lots of these bandages on Amazon. You can just type the area. So say heel bandage. If you put something like that, they should come up. So if you have damaged tissue or infected tissue, any kind of tissue that is not optimal for healing, it may need to be debrided or removed. Okay. So either the wound care specialist or doctor, they'll be doing that. Other interventions, so pain control, because they can be quite painful, a healthy diet, and sometimes you need surgery to close these. So it's called a flap surgery. It's where they use muscle, skin, or other tissue to put a cover over that area to kind of cushion the bone. So when to see your doctor, okay? So if you're noticing warning signs, you want to alleviate pressure right away, okay? If you're not noticing any changes within 24 to 48 hours, you need to contact your doctor. Now, you're going to seek immediate medical care if you're showing these following signs: a fever, drainage from the sore, sores that smell bad, sores that are changing in color, or if there is warmth and swelling around the wound, okay? Because those are signs of infection. Once you get that fever, it's a quite significant infection. So you want to be contacting the doctor immediately, seeking immediate medical care. So I hope this video did give you a better understanding of what a pressure ulcer is, or bed sore, and how we treat it. Okay, prevention over cure is what I always like to say. But that's all I got for this video, guys. I hope to see you in my next one. Have a great day.